What if I told you that the blood pressure number you've been told to chase your entire life might actually be dangerous after the age of 65? For decades, we were told one thing: 120/80 is perfect, lower is better. But new research shows something shocking. For older adults, pushing blood pressure too low can cause dizziness, falls, broken hips, loss of independence, and even death. Today, you'll learn the real blood pressure targets for seniors, why 120/80 isn't always safe, and how to protect yourself starting today. Stay with me. This information could save a life.
For decades, most doctors have followed one simple rule: get everyone to 120/80. It sounds clean, it sounds precise, and it sounds safe. But here's the uncomfortable truth. That rule was never designed for people in their 70s, 80s, or 90s. It was built on studies of middle-aged adults, people with flexible arteries, fast reflexes, and strong balance systems. Aging changes everything. As we get older, blood vessels naturally stiffen. The brain becomes more sensitive to sudden pressure changes. Balance reactions slow down, and medications stay in the body longer and hit harder. What helps at 45 can quietly harm at 75. When blood pressure is pushed too low in seniors, the brain may not get enough blood, especially when standing, walking, or waking up at night. The result? Dizziness, falls, blackouts, broken hips, and in many cases, loss of independence. And this isn't theory. Let me tell you a real story. An otherwise healthy 82-year-old woman was placed on aggressive blood pressure medication to hit perfect numbers. Her readings looked great on paper, but within weeks she began feeling lightheaded when standing. One night she got up to use the bathroom, her blood pressure dropped suddenly, she collapsed and fractured her hip. She never fully recovered. Her numbers were perfect. Her outcome was not. This is the danger of treating seniors like younger adults. Blood pressure in older age is not just about numbers. It's about blood flow, stability, and safety. And in the next chapter, I'll show you why slightly higher blood pressure can actually protect the aging brain, and when lowering it too much becomes a serious risk. Stay with me.
Eleanor was 78 years old. She wasn't frail, she wasn't sick, she wasn't declining. She lived alone, did her own shopping, walked every morning, cooked real meals, drove herself to appointments. In every way that mattered, Eleanor was independent. At a routine checkup, her doctor noticed her blood pressure was a little high, around 152/88. Not dangerous, not urgent, but above the textbook target. So the medication began. At first, Eleanor didn't notice much. Then the dose was increased, and then increased again. Each visit ended the same way. We just need to get you closer to 120/80. Eventually, the numbers looked perfect, 122/78. Her chart looked beautiful. Her doctor was thrilled. But Eleanor wasn't. She began feeling strange when she stood up. The room would spin for a few seconds. Her legs felt weak, like they didn't fully belong to her. She started holding on to furniture, moving more slowly, avoiding stairs when she could. She told her doctor. The response? That's just aging. Give your body time to adjust. The numbers look great. But her body was already telling a different story. One morning, Eleanor sat up in bed. Her blood pressure dropped suddenly, faster than her brain could adapt. Before she could grab the nightstand, before she could call for help, she collapsed. The fall shattered her hip, and that single moment changed everything. Surgery followed, then weeks in a hospital bed, then rehab she never fully recovered from. Her muscles weakened, her confidence disappeared, fear replaced independence. She became afraid to stand, afraid to walk, afraid to fall again. Then came the complications. Immobility led to lung congestion. Congestion turned into pneumonia, and pneumonia became the final blow. 6 months after that perfect blood pressure reading, Eleanor was gone. Not because her blood pressure was too high, not because her heart failed, but because her blood pressure was pushed too low for her aging body. This is the part no one talks about. In seniors, falls are often more dangerous than hypertension, and overly aggressive blood pressure control can quietly increase fall risk without warning. Eleanor didn't need perfect numbers. She needed stable blood flow. She needed adequate pressure to the brain. She needed balance, strength, and safety. And in the next chapter, I'll explain exactly why the aging brain needs slightly higher pressure to stay protected, and how doctors are finally starting to recognize this dangerous mistake.
So why does this happen? Why can something that looks healthy on paper become dangerous in an aging body? The answer is simple. Aging changes the rules. There are 4 critical reasons low blood pressure becomes risky after 70. Reason number 1. Stiffer arteries need more pressure. When you're younger, your arteries are elastic. They expand and contract instantly as you stand, sit, or move. But with age, arteries stiffen. They don't respond quickly anymore. That means when a senior stands up, blood doesn't rush to the brain fast enough unless pressure is slightly higher to begin with. Lower the pressure too much, and gravity wins. The brain is briefly starved of oxygen. That's when you feel dizziness, lightheadedness, weak legs, blurred vision, and sometimes no warning at all. A pressure that looks ideal for a 40-year-old can be insufficient for an 80-year-old brain. Reason number 2. Slower pressure sensors. Your body has built-in pressure sensors called baroreceptors. Their job is to detect drops in blood pressure and correct them instantly. But with age, these sensors slow down. They still work, just not fast enough. So when pressure drops suddenly, standing from bed, getting up from a chair at night, the correction comes seconds too late. And in those seconds, seniors fall. This is called orthostatic hypotension, and it's one of the strongest predictors of falls in older adults. Reason number 3. Medications hit harder and last longer. Older bodies process medications differently. Liver clearance slows, kidney filtration weakens, drug half-lives increase. That means medications stay in the system longer, effects stack up over time, and blood pressure can drift lower each day. The same dose that was fine last year can become too strong this year. And many seniors are on blood pressure meds, diuretics, heart medications, sleep aids, stacking effects without realizing it. This is why low blood pressure episodes often happen weeks or months after starting medication, not right away. Reason number 4. The risk profile changes with age. At 40, the biggest threat is long-term damage, stroke, heart attack, kidney disease. At 80, the biggest threat is falling today. Falls are not minor events in seniors. One fall can lead to hip fractures, head injuries, loss of mobility, fear of movement, and rapid physical decline. Statistics show that many seniors never fully recover after a serious fall. And here's the uncomfortable truth. Slightly higher blood pressure is often safer than pressure that's too low. Not uncontrolled, not ignored, but individualized. Because survival after 80 isn't about perfect numbers. It's about brain perfusion, balance, strength, stability, and staying upright. In the next chapter, we'll talk about what blood pressure ranges actually make sense for seniors, and why many experts are quietly moving away from the one-size-fits-all target. This information could prevent a fall or even save a life.
Now let's talk about what the science actually shows. Not theory, not outdated guidelines, but real-world outcomes in older adults. Because when researchers stopped guessing and started following seniors over time, a very different picture emerged. Large observational studies tracking adults over age 75 asked a simple but critical question. At what blood pressure do seniors actually live longer? Not what looks ideal on a chart, not what works for middle-aged adults, but what reduces deaths, falls, and hospitalizations in real life. The answer surprised a lot of people. The safest blood pressure range after 75. Across multiple studies, the lowest death rates occurred when systolic blood pressure, the top number, stayed between 130 and 140, not below 120, not aggressively tight controlled, right in the middle. This range provided enough pressure to feed the brain, enough flow to prevent dizziness, and enough stability to avoid falls. It was the sweet spot for aging circulation. What happened below 120? When systolic pressure dropped below 120, researchers saw something alarming. Risk went up, not down. Seniors in this range had significantly higher rates of falls and fractures, fainting episodes, acute kidney injury, emergency room visits, and even higher overall mortality. In other words, numbers that looked perfect were actually dangerous for older bodies. Why? Because blood pressure that's too low can't overcome stiff arteries, slower reflexes, and gravity when standing. The brain doesn't get enough blood, and the body pays the price. What about high blood pressure? Now, let's be clear. Letting blood pressure climb unchecked is not safe either. When systolic pressure consistently rises above 150, risk shifts again. Researchers saw increases in stroke, heart failure, and vascular damage. So this isn't an argument for ignoring blood pressure. It's an argument for precision. The middle was the safest. The data showed something very important. The safest place for most seniors was not the lowest number. It was the middle range, high enough to prevent falls, low enough to protect the heart and brain. This challenges the idea that lower is always better, because after a certain age, lower means weaker, unsteady, and vulnerable. Why guidelines are slowly changing? Many experts now quietly acknowledge this shift. They're moving away from one-size-fits-all targets and aggressive medication stacking, and treating numbers instead of people, and toward individualized goals, fall risk awareness, quality of life, and independence. Because longevity after 75 isn't just about preventing strokes 10 years from now. It's about staying upright, staying independent, staying alive today. In the next chapter, we'll talk about how to know if your blood pressure is too low for you and the warning signs most seniors are never taught to recognize. This is information every older adult and every caregiver should hear. So if 120/80 isn't always the safest goal after a certain age, what should seniors actually aim for? This is where context matters, because blood pressure targets must change with age, strength, and stability. What you're about to hear are guidelines, not rigid rules. They're meant to start conversations, not replace medical advice. But they reflect what modern research and geriatric medicine now understand. Ages 65 to 75, healthy and independent. If you're in your late 60s or early 70s, still active, steady on your feet, and not experiencing dizziness, a reasonable target is 130 to 140 over 70 to 85. This range protects the heart and brain, maintains adequate blood flow, and minimizes medication side effects. For many people in this group, aggressive lowering offers little benefit and growing risk. Ages 75 to 85, slower reflexes, higher sensitivity. Between 75 and 85, your physiology changes further. Your arteries are stiffer, your balance responses are slower, medications last longer in your system. For this age group, a safer range is 135 to 145 over 70 to 85. This slightly higher pressure helps prevent dizziness when standing, keeps blood flowing to the brain, and reduces fall and fainting risk. At this stage of life, stability often matters more than numbers. Over 85 or frail, safety first. For adults over 85 or anyone who is frail, underweight, or has already fallen, priorities shift again. The goal is safety and independence, not textbook perfection. A common safe range is 140 to 150 over 70 to 85. Yes, higher than you were probably told, but in this population, pushing pressure too low can be far more dangerous than leaving it slightly elevated. Falls, fractures, hospitalizations, and loss of independence carry enormous risk at this age. Why preventing falls often matters more. Here's the truth that rarely gets said out loud. For many seniors, a fall is more immediately dangerous than a stroke years from now. Falls lead to broken hips, head injuries, loss of mobility, loss of confidence, and in many cases, rapid decline. Blood pressure targets that increase fall risk, even if they look ideal, may actually shorten life. One number matters more than all others. And now we come to the most important point. There is one blood pressure-related number that matters more than systolic, more than diastolic, and more than any guideline chart. It's the number that predicts falls, fainting, hospital visits, and sudden decline. In the next chapter, I'll reveal the one measurement most seniors are never told to watch, yet it may be the most important of all.
There is one blood pressure warning sign that matters more than almost any number on a chart. Most seniors have never been told about it. It's called orthostatic hypotension. That term simply means this: your blood pressure drops when you stand up. And after 60, this is one of the strongest predictors of falls, fainting, and sudden injury. Why this happens with age? When you stand, gravity pulls blood toward your legs. In younger bodies, the nervous system reacts instantly. Blood vessels tighten, heart rate adjusts, blood flow to the brain stays steady. But with aging, this response slows. Arteries are stiffer. Pressure sensors react more slowly. Medications last longer. So when you stand, your brain may not get enough blood, even for a few seconds. That's all it takes. Why perfect numbers can still be dangerous. Here's what makes orthostatic hypotension so tricky. Your blood pressure can look perfect while lying down. 120 over 75, 118 over 70. Your doctor may be pleased, but when you stand, the pressure drops suddenly. The brain is briefly starved of oxygen, and that moment can cause dizziness, blurred vision, weakness, blackouts, or a fall without warning. This is why numbers taken in a chair don't tell the whole story. How to test this safely at home. You can check for orthostatic hypotension at home. Do this calmly, never rush. Lie down and rest quietly for 5 full minutes. Check your blood pressure and write it down. Stand up slowly. After 1 minute, check again. Now compare the top number. If your systolic pressure drops by more than 20 points, that's a red flag, even if the first number looked ideal. Dizziness is not normal aging. This is critical to understand. Feeling dizzy when you stand is not just getting older. It is your body telling you, I am not getting enough blood to the brain. Ignoring that signal is dangerous. Too many seniors are told, sit down, move slower, be careful. But the real solution is finding why the pressure is dropping. What orthostatic hypotension is warning you about? This condition often means medications may be too strong, blood pressure targets may be too low, hydration may be inadequate, or the nervous system needs support. And the earlier it's addressed, the safer you stay. What comes next? In the next chapter, I'll show you the most common causes of orthostatic hypotension, which medications trigger it most often, and how many cases are fully reversible. Because dizziness is not something you live with, it's something you investigate and fix.
Here's a truth many seniors discover the hard way. Blood pressure is not one size fits all. Some people feel strong, clear-headed, and steady at 140/85. Others feel exhausted, dizzy, and fragile at 120/80. And that difference matters more than any chart. Why numbers alone don't tell the story. Blood pressure is just a measurement. It does not tell you how steady you feel when you stand, whether your brain is getting enough blood, if your muscles are reacting fast enough to keep you upright, or how confident you feel moving through your day. Two people can have the exact same reading and completely different realities. That's why chasing a perfect number can quietly destroy quality of life. The real goal after 60. After midlife, the priority shifts. It's no longer just about preventing problems 20 years from now. It's about living well today. The true goals become clear thinking, strong balance, confidence when walking, freedom to move without fear, and independence in daily life. If a blood pressure target steals those things, it's the wrong target, even if it looks good on paper. Why feeling off is important data. If you notice brain fog, fatigue, lightheadedness, weakness when standing, or fear of walking alone, those are not inconveniences. They are clinical signals. Your body is telling you that circulation is being compromised, and your experience matters just as much as the numbers. What good doctors already know. The best doctors don't treat readings, they treat people. They ask, how do you feel during the day? Do you feel steady when standing? Have you had near falls? Has your energy changed since medication adjustments? This approach has a name in medicine. Treat the person, not the number. And it becomes more important with every passing decade. Your blood pressure should support your life. The right blood pressure for you is the one that allows you to think clearly, move confidently, stay independent, sleep well, and enjoy daily activities. Longevity means nothing without quality, and safety always comes before perfection. Coming up next. In the final chapter, we'll talk about how to discuss safer targets with your doctor, what questions to ask, and how to protect both your heart and your independence. Because living longer should never mean living smaller.
Now that you understand why blood pressure targets can be dangerous if treated blindly, let's talk about what to do today, the steps that put you back in control of your health. 1. Start checking at home. Don't rely only on the numbers at the doctor's office. Get a reliable home monitor and track your readings daily at the same time each day. Accuracy matters. This is your evidence, not guesswork. 2. Test standing versus lying. Orthostatic hypotension, the dangerous drop when standing, is easy to miss if you only check lying down. Here's how. Lie down for 5 minutes. Record your blood pressure. Stand up carefully. Record it again after 1 to 2 minutes. If your systolic drops more than 20 points, that's a red flag. This simple test can prevent falls and alert you to adjustments before an accident happens. 3. Track how you feel. Numbers alone are not enough. Write down dizziness, lightheadedness, fatigue, and heart racing or skipping beats. This personal data tells your doctor how your body actually responds, not just what the chart says. 4. Bring real data to your doctor. Doctors make safer decisions when they see patterns, not just a one-time reading. Your daily measurements and symptom notes give them the full picture, so medication can be adjusted intelligently. 5. Ask for individualized targets. Don't settle for generic 120/80. Ask, what range is safest for me right now? How can we balance blood pressure with fall risk? Can we adjust timing or dose to reduce dizziness? Every senior is different, and your targets should reflect your life, not the textbook. Important reminder: never change or stop medications on your own, but never ignore symptoms either. You can be proactive and safe at the same time. The goal is simple: protect your heart while staying steady, independent, and confident. This plan is practical, measurable, and puts you in the driver's seat of your health. Take these steps now. Your body will thank you tomorrow.
120/80 is not sacred. For many seniors, it's too low. A slightly higher pressure can mean fewer falls, better brain blood flow, stronger kidneys, more years of independence. If this video helped you, share it with someone over 65. It could prevent a fall. It could save a life.